I'm now being joined by Dr. Sam Amadi, is a director at the Abuja School of Social and Political Thought, and he's here to look at the rising cases of alleged negligence in Nigeria's health sector. Very warm welcome, Sam, to Newsnight. This is gradually becoming an ugly phenomenon.
Even an epidemic, you might say.
Yeah, but this must be addressed. Is it a matter of the attitude, the poor working environment? One would have ascribed that to, public health sector, not the private health sector, where millions are paid and the rest, and yet you find this kind of negligence.
I think it's getting an epidemic proportion, because if you look at social media story, this is not just an isolated case. It's like several cases, whether it's Tony, the boxer, or whether other low-key Nigerians. In fact, stories too many. But then it's a triad, what they call public policy triad. So first, I think there's a culture. Two, professionalism, and three, accountability. Now, if you look at the cultural aspect of it, there is a generalized inefficiency and negligence in the way Nigerians do things, which may arise from deeply rooted cultural problem. I used to teach a course to the Foreign Academy, and I used to teach what I call national ethos. And that means that Nigeria has national ethos, whether it is no grief for them, or whether it is anyhow, whether it is make your money. So a typical cultural attitude is an attitude that is presumptive, we don't plan. Look at the story, whether it's still being investigated, but clearly alleged procedural failures. And it happens that I had my daughter once go for, just extract a tooth, and the expert doctor did the work, but the anesthesiast, the lady who does anesthetics, overloaded it, didn't time it well, the operation finished. The doctor says 5 minutes should be out. 30 minutes not out. The doctor was panicking. And later he told us that the lady putting the anesthetics longer. It didn't even time. So this is managerial failure. You don't time the operation. So this is one aspect, culture. The second aspect is what we call professionalism. There's a book by Harvard endocrine surgeon, a guy, Atul Gawada, who is a professor. He wrote a book called Checklist Manifesto. And he talked about whether it's flying, whether any complex activity, checklist work. So it looks simple, but what should be done? The story from Chimamanda, okay, you put somebody, sedate a child, you ought to monitor the child, you ought not to carry the child on the shoulder. Now, all those things are checklists. Interestingly, one Nigerian young doctor who trained abroad came to me once in my office and said, look, she did the housemanship, and I know that she sees emergencies, people dying, because the doctors forget the checklist. So she told me to finance cardboard, just cardboard. She writes like idiot card. When this happens, do this, so she can place it
strategic areas of the hospital.
Simple things like that, checklist. If you look at some of the cases of alleged malpractices or negligence, is failure to follow what is almost like elementary due process. So there is a professionalism problem here, which is that our everyday life is no longer governed by norms of professionalism, looking at efficiency, getting things done, following the grid.
Isn't that a shame? Coming
from... Sorry, and the third one is accountability. So this is triad, culture, professionalism, and accountability. Now, accountability is like incentive structure. People don't get punished. Now, the Lagos State government has probably put up this investigation. If they come out with, the result, and a hospital gets sealed permanently, trigger. So we have in our system accountability. You get anything done, we are sorry. And even the victim's family will feel like we can't bring her back. So we don't have cases.
Yes, you've raised very key issue here, accountability, checklist and the rest. So what happens in the failure of a situation like that?
So from a medical law perspective, they have the medical and dental practitioners, council that oftentimes cites doctors for malpractices. But if you look at the medical law component of it, both the courts, the punitive nature of damages, the procedures for proof needs to be reformed. And so doctors and other health practitioners escape liability for two reasons. One, difficulty of proof. Some of the professionals refuse to testify. They feel like they have, just this African
for
thing
each
of,
other.
let's put ourselves. So
Yeah.
elsewhere, in other jurisdictions, doctors themselves volunteer and prosecute their defaulting, erring, member. But here, that's a sense of not willing to come
So that
out.
the person does not become a danger to society.
And so that you internalize due diligence, seriousness. Most of these cases of death are not like failure of medical research. It's like complex cases. They are, if you investigate, discover that, they didn't switch off this. They didn't have enough oxygen when they went into ICU, and then oxygen expired, and they run about. Basic things that speak at gross inefficiency.
And the doctor was carrying the baby on the shoulder.
These are things you punish people severely, jail them, remove their licenses, and massive penalty for hospitals. And again, back to the issue of management. If you look at top hospitals abroad, some doctors are managed professionally by managers, people who studied management. So the fact that you're a doctor does not mean that you can
make you a good manager.
So oftentimes, poor management, the systems are not well laid for response. Okay, the medicine, but then there's a process for administering that care. And somebody has to lay out for you, step by step, what to do. And so the triad of culture, the culture we have in Nigeria of anyhowness, of gross and generalizing efficiency and lack of diligence. And people don't even focus on what they do, whether they're doctors, civil servants, lawyers, everybody. There's a sense in which, and then the issue of professionalism. Let's not talk about the training of this university, of some of our doctors and professionals. I mean, if our universities have collapsed, as they have done, then it follows that some degree of degradation in
would
knowledge
have crept into
and practice will creep in. Again, the issue around accountability. So what the heck? I'm not going to bother.
Let me ask you, Dr. Sam, is government really doing well or serious about its reform? And what three areas, of reform in the health sector would you suggest for a quick improvement? First, in patient safety, rebuild public trust in Nigerian hospitals.
And this is about public policy, not even about the medical profession. First is access. You see, we're talking about a privileged Nigerian who can afford top-notch medical care. Talk about the millions of Nigerians who have no access, who are treated with impunity because the system, they're illegible. The system doesn't recognize them, they can't pay for their services. So access is a big one. With the National Health Insurance Scheme, we ought to have improved access, but essentially, I'm not sure to do that. The second thing about this is also a sense in which there is regulatory discipline. You see, the regulatory agencies, whether internal regulation, the medical board, or external, there is lack of, strict regulatory ethos and practice. So you need to be focused more on what Lagos have done, for example. You go to the hospitals, you look at the theater, you look at their holding area, you look at, it really could contaminate people. People could actually get sicker going to those hospitals. So there is a sense of general regulation, lax regulation. And of course, government itself doesn't care much about healthcare of Nigerian citizens because most of them, they have no skin in the game. Many of our leaders are accessing international foreign healthcare services, whether you hear about whether it's Senate president or governor, they say has gone for medical treatment abroad, medical check abroad. So if leaders don't have skin in the game, they don't access the primary healthcare, they don't access the secondary, they don't access the tertiary level, why would they invest in even monitoring the delivery of that service? The same with our schools. The reason why every day is a struggle between ASU and the government, between doctors, resident doctors, and the government, NM government, is bigger because healthcare, education are not politically incentivized. Their children don't go there. They don't go to those schools. So why would they invest so much? So the low investment in both the financing and as well as the management and the oversight of health institution has a political economy explanation. That government has no skin in the game, and government doesn't get punished. So have you seen Nigerians protest over quality of healthcare? In the US, the big issue on any campaign trail is either access or quality or coverage for health issues. Yeah. Here, it never features in our discourse because essentially we're not treated as citizens. We are like natives and citizens and subjects. So the citizen is a subject, and therefore expectation of well-being figuring into political calculus is not there. So I think that the basic thing Lagos probably could set the example by thorough investigation and very high-handed, severe punishment, including closure, even permanent closure, if they trace that basic lack of diligence. This is not about rocket science. It's not about top medical care. It's about should you have paid attention? Should you have monitored this? Should you have carried this person in this mode? And I can tell from experience, my own daughter and several people around me, that the default would be that most likely none of those things were monitored because nobody cares. There's no accountability. Every day you hear stories of people dying negligently. Do you hear about compensation? How many times would the judge be brave enough to slam a big hospital with, let's say, millions or even billions and run them out of business? And that internalizes due process, diligence, vigilance. In fact, the owners of the hospital will not punish, expel, So they create a second level monitoring. So they are monitored, damnified in damages. They go down to monitoring their doctors and their paramedics and everybody and institutionalizing a real procedure, the checklist, the kind of thing Professor Gawa talked about, say, checklists that help everybody stay focused, just like the pilot. If you look at the pilot, their job is simply They have a checklist, they make sure, once the checklist is over, the plane takes off. So doctors, the lady told me, said, nowhere, help me procure dashboard so that the emergency care, people look at it and say, this person came with, have I checked the BP? Have I checked whether it's hypertensive? Some people go for operations and they die because the basic thing about checking BP, nobody checks the BP, they are hypertensive, and you put them through the knife.
That would be the strangest thing for any health
As a policy
facility
person, I get this data every day. And that's why I'm building the model. The triad of culture, professionalism, and accountability is the solution, and the lack of it is the problem.
Thank you. Thank you so very much. Dr. Sam Amadi is the director of Abuja School for Political and Social Thought and a RISE analyst for coming to shed light on this.